Now copper releasing IOD that suppress the sperm motility and fertilizing capacity of the sperm. Now hormone releasing IODs in addition to it, like make uterus unsuitable for implantation and the cervix hostile to the sperm. So that's it. Now like oral contraceptions, like they contain either progesterone or estrogen combinations. Now they are tablets and some in the form of pills. Now it is taken for 21 days, starting with first 5 days of menstrual cycle and after a gap of 7 days, so during which menstruation occurs. Now this is it. Now these pills, all these oral contraceptives, they inhibit ovulation and implantation, as well as alter the quality of cervical mucus to prevent and retard entry of the sperm. Now pills, they are that's it. Now there is like Saheli, once a week pill. It is non-steroidal preparation, right? And then progesterone alone or in combination with estrogen, they also use as injections or implants under the skin. Their action is similar. Now progesterone or progesterone estrogen combinations or IODs within 72 hours of coitus, they can be taken in the emergency, right? And then surgical methods include sterilization. Now vasectomy, tubectomy. Vasectomy, in the vast difference in males is cut and tied up, and in tubectomy the fallopian tube is cut and tied up, and this is the permanent sterilization. Reversibility is almost zero. This is the surgical intervention that the principle is that blocks the gamete transport and thereby prevent conception. It does not affect gametogenesis. Still semen is formed, still ovum is formed, that's it, but their transportation is blocked. Now MTP. Okay, so coming to the STIs. Now what about STIs? STIs, due to the sexual intercourse, um, these are like STIs, sexual transmitted disease or venereal disease, that is VD, or reproductive tract infections, RTI. Now gonorrhea simplex, genital herpes, chlamydiasis, genital warts, trichomoniasis, hepatitis B. Okay. Now HIV causes the AIDS. Okay, it is most dangerous. Now hepatitis B and HIV and genital herpes, these are not curable. Okay, other STIs can be curable if detected early. Now infertility, you see infertility, there is like there are infertility clinics now, and after that there are ART, that is assisted reproductive technologies, now in which there is in vitro fertilization, that is fertilizing outside the body in almost similar condition as that in the body. So this IVF, after that the embryo transfers. Okay. Now this involves like test tube baby. This involves test tube baby, and now there is zygote intrafallopian transfer. So the zygote or early embryos up to 8 blastomeres transfer into fallopian tube. So this is zygote intrafallopian transfer. Embryos with more than 8 blastomeres, okay, they transfer into uterus, that is IUT, there is the intrauterine transfer. Okay. Now embryos formed by in vivo fertilization. Now what is in vivo? It is fusion of gametes within the female. Those people who cannot conceive. Okay. Now gamete intrafallopian transport. Now those people who does not have ova, so gamete intrafallopian transfer. Then there is like intracytoplasmic sperm injection in case of like if male partner is unable to inseminate the female or due to very low sperm count, this is under the artificial insemination, right? So in vitro the sperm is injected into the womb outside the body. Now okay, another thing is like intrauterine insemination, so direct insemination into the uterus, that's it.